Yes, playing Bridget Jones because I'm sad, middle-aged woman and living in London.
You're not sad, you're not middle-aged, you're beautiful, talented, you've got a lovely daughter, a great partner, and it's been an absolute pleasure working with you. Crack on.
That's so sweet.
Everybody in the gallery is going, what the hell's coming next?
Don't worry, it's the pneumonia medication. Our top story today, a landmark review is warning that children who've been seeking gender care have been let down by a lack of research, saying that there was no good evidence for giving transitioning drugs.
We've been talking about it all morning. The Cass review is calling for gender services for young people to match the standards of other NHS care, whatever that means, after it discovered the toxicity surrounding the debate about gender is having a negative impact on medical professionals. Now, earlier, we've been doing this all morning, we spoke to transgender teacher and journalist Debbie Hayton, who told us that more needs to be done to safeguard children. Have a listen and a watch.
Abigail Schreier wrote a book, Irreversible Damage, that talked about the contagion that was going on, you know, the social contagion that was going on, especially in groups of girls, a group that had never really come on the radar of gender identity clinics. Mainly it was middle-aged men. Then suddenly these teenage girls appeared, and the same rules seemed to be applied to that group as what had been hitherto applied to middle-aged men, people who were old enough and mature enough to know the consequences of these actions.
Well, joining us now is former Director of Comms for Number 10, Jonathan Haslam. Jonathan, good morning. It's not always an issue that we would talk about necessarily with you, but it is dominating the newspapers this morning. What do you make of the Cass review?
Well, yesterday we saw somebody of great integrity in Alan Bates telling it like it is to an important tribunal. And today, thank heavens, we've got another one. Dr. Hilary Cass has come out with a 300.
We've got a problem with your mic. I'm going to have to jump in. Sorry, not a problem. We'll just work on that. This whole and poor man's going to have to hold a microphone. Right, back to stars in their eyes. Jonathan Haslam, tonight you are.
I'm carrying on where I was finished.
Good man.
So I'm going to say, Hilary Cass got a 338-page report of pure common sense here. She's forensic in her analysis, and we do need to look at the background to this. Now, you know, we've got to accept that people are different, but there is a bit of a bandwagon, I think, on trans activities, and that has swept up a lot of people. And we're talking here about some of our most vulnerable people, the young people in society. Now, we do know, physiologically, your brains don't actually get their full wiring until you're in your late teens and early 20s. Yet younger and younger people are reporting gender dysphoria, as it's called, at an earlier age, and there lies the problem. Because what's happened in the medical field is they've just said, great, now here's a pill for it, here's a drug for it, you know, we accept it. Hilary Cass has really delved into the detail and says, it's more complicated than that, and your first resort must not be just to go to the drugs. Think of a holistic approach and help these people through.
It's a process, though. Nick and I were talking about this earlier, and it's really interesting taking people's opinions on this, because it is a debate that needs to be had. Linda Bellows made a really good point, and she used the word fashionable. There will be people, absolutely rightly, who are not sure about their gender, but it's a process. And I don't personally believe that at the age of 16, 17 or 18, maybe you're right, maybe you're not developed enough. I'm not dissing that people have these thoughts, but I'm talking about the psychological. You're talking about holistic health, rather than giving him a puberty blocker. And she said, and I'd really love your opinion on this, and I'm not disrespecting anybody, has it become fashionable? That's a worry.
Well, look at the numbers, because I think they tell us quite a big story. In 2008, what we had was something like 50 referrals to some of these gender clinics for analysis. In recent years, last year, for example, it was around about 1,600. Now, that suggests to me that, you know, there are a number of things going on in society, and I think fashionable can be one of them for people who are confused about things, people who've gone through COVID and had all the lockdown issues we've had with schools, social media, which isolates people. Sure. It's a very curious thing. It isolates people as well as brings people together.
Could you not put that down to, though, the amount of coverage that there is in the press? I'm not, you know, I think people should be uncomfortable with suggesting that, you know, something as serious as this is a trend. People say it about mental health and stuff as well. There are just
I'm not saying a trend, I just worry,
different
Nick.
topics that we end up talking about that, of course, might mean that children are talking about it more, thinking about it more. It could also mean, actually, that 5 years ago, 10 years ago, there were just as many children who felt like they couldn't talk about it, but now they do. And I'm not necessarily saying that they should be given
that might be right,
care.
and that's important, Nick, but what we're talking about is the process of dealing with that, and is giving puberty blockers or having an operation within 2 weeks. It should be a long, detailed psychological process.
Absolutely, because
that's what I think Debbie Cass is
at least
talking
with
about.
puberty blockers, we have no idea about the long-term impacts on children's health. No idea whatsoever it's going to do for them for the 60 or 70 years that they could live.